I think in this example, and the volume of opioids that were being placed on the streets of Portsmouth, Scioto County, the region, and the nation, I think that an example should be made of individuals that are doing this wholesale prescribing of prescription medications. I think clearly we are above and beyond those that are legitimately practicing medicine, that are legitimately prescribing those medications. And I think more efficient, more prompt action should be taken in those examples.
And I think that, that's the key there, Chief Warner, is the prompt action. One thing that doesn't need to happen is circumventing due process for anyone. However, prompt due process is a different story.
Absolutely.
Prompt due process when they're, all signs point to someone practicing outside the bounds of the profession, and quite honestly, breaking the law in many instances. Run through that due process, and make the streets ultimately safer because of that.
And what about the association, Ohio State Medical Association? Is there some peer pressure that can be made to come to bear on situations like this? And if so, what did they do in this situation?
Well, I think the first thing, we've worked with Director Hall on this, and are going to continue to do so, is educating physicians around the state. Making sure that physicians around the state fully understand the scope, the enormity of this epidemic that is ravaging parts of our state and ravaging, really parts of our country. And then from there, everything that we have heard from every legitimate medical provider, which by and far is most medical providers out there, they're on board. I mean, the Ohio State Medical Association is on board. Other physician groups are also on board, but it starts with the education, and then moving forward, it's working together, having conversations like this across all sides to find the next step. I mean, House Bill 93 is a great step. It's a great first step. We're going to need to do more. I mean, would you agree?
I would agree. And by the way, just to give you a sense of the magnitude, and the governor uses this statistic a lot, in 2010, there were 9.7 million doses of opiate prescriptions dispensed, legally dispensed and tracked to the residents of Scioto County. Scioto County has roughly 78,000 residents, so that is 123 doses for every man, woman, and child that lives in that relatively small county.